So when I'm looking at hip mobility specifically to improve my squatting technique, one of the things to consider is when I'm sitting in a typical chair, I spend a lot of time with gravity pulling my body down, shifting the femoral head up in the hip socket. In order for me to do a nice deep body weight squat, my femurs have to drop down and back. So one of the things we see in the gym quite a bit is we see athletes sit and press the knees out because we've heard for a long time that I need my knees out and my toes straight to check and work on my hip mobility. What I'm suggesting is instead of just driving the knees out, which reflexively has a tendency to make my nervous system want to pull my knees in, I prefer elbows in front, driving the knees back, stretching the posterior hip capsule and the inferior hip capsule. So again, I put my hands in front, I drive my knees back into the hip socket. This helps to extend the torso, it activates the lats, which gives me some thoracic extension. I'll perform this hip mobility exercise for 2 to 3 minutes as I shift side to side and really kind of, as Kelly Starrett says, work the back corners of that hip socket.